Hello friends, today we are going to discuss about anemia nursing care plan. What is anemia? Condition in which there is a lack of red blood cells or deficiency of hemoglobin in the blood to deliver oxygen to tissues. There are 5 types of anemia: Iron Deficiency Anemia, Sickle Cell Anemia, Aplastic Anemia, Thalassemia and Deficiency Vitamin Anemia. Iron Deficiency Anemia. Iron Deficiency Anemia is most common type of anemia that occurs when the body does not have enough iron. Without enough iron, the body cannot produce enough hemoglobin. Hemoglobin is a substance in the red blood cells that enables them to carry oxygen. Causes for iron deficiency anemia. First one is bleeding, like GI bleeding, colorectal cancers, heavy menstrual bleeding, trauma, and hemorrhoids. Next one is hookworm infection, iron malabsorption, insufficient intake of iron. Risk factors for iron deficiency anemia: gender, especially women, infants and children, vegetarians, and frequent blood donors. Signs and symptoms of iron deficiency anemia: pale skin, cold hands and feet, extreme fatigue, inflammation, weakness, brittle nails, chest pain, shortness of breath, headache, and dizziness. Management: treatments for bleeding condition, blood transfusion, improve dietary intake of iron, give iron supplementary. Nursing assessment: subjective data, patient complaint of fatigue and dizziness. Objective data, low hemoglobin level and pale skin. Nursing diagnosis: fatigue related to decreased hemoglobin and decreased oxygen carrying capacity of the blood. Nursing call: to reduce fatigue. Planning: monitor vital signs regularly. Monitor blood investigation reports. Example: whole blood count, ferritin, and serum iron. Encourage to gradually increase in physical activity. Monitor oxygen saturation level. Promote adequate rest and sleep. Administer iron supplements as prescribed. Administer iron supplements as prescribed. Implementation: monitored vital signs regularly. Monitored blood investigation reports. Encouraged gradual increase in physical activity. Monitored oxygen saturation level. Promoted to adequate rest and sleep. Administered iron supplements as prescribed. Evaluation: blood pressure, pulse rate, respiratory rate, body temperature, and saturation level. Nursing assessment. Subjective data. Patient complain of heavy menstrual bleeding or GI bleeding or hemorrhage. Objective data. Pale skin, hypotension, tachycardia, and decreased hemoglobin level. Nursing diagnosis. Risk for decreased cardiac output related to reduced circulatory blood volume. Example, heavy menstrual bleeding or GI bleeding or hemorrhage. Nursing goal. To maintain effective cardiac function. Planning. Monitor and record vital signs and saturation. Monitor signs of bleeding. Administer medication for as prescribed for bleeding. Give iron supplements as prescribed. Administer blood transfusion if needed. Monitor laboratory values. Educated to avoiding strenuous activity. Implementation. Monitored and recorded vital signs and saturation. Monitored signs of bleeding. Administered medications for as prescribed. Given iron supplements as prescribed. Blood transfusion done. Monitored laboratory values. Educated to avoiding strenuous activity. Evaluation. Blood pressure, pulse rate, respiratory rate, body temperature, saturation level, and hemoglobin level. Sickle cell anemia. An inherited red blood cell disorder. In sickle cell anemia, the red blood cells are shaped like sickles or crescent moons. These rigid streaky cells get stuck in small vessels and slow or block blood flow. Causes. Hereditary. Signs and symptoms of sickle cell anemia usually appears around 5 months of age. Unexplained episodes of severe pain in chest pain, abdomen, joints, bones, swelling in feet or hands, abdominal swelling, cold extremities, frequent infection, fever, fatigue, jaundice, and weak peripheral pulse. Management cannot cure, can give sympathetic treatments. Example like can give analgesics for pain, can give antibiotic for infection, vitamin supplements, and steroid. Nursing assessment. Subjective data. Swelling in the hands. Objective data. Cold extremities. Weak peripheral pulse. Capillary refill time. Nursing diagnosis. Ineffective tissue perfusion related to obstruction in the blood flow by secreted red blood cells as evidenced by cold extremities and delayed capillary refill. Goal. To to maintain adequate tissue perfusion. Planning. Assess saturation level. Assess capillary refill time. Administer oxygen as prescribed. Administer medication as prescribed. Elevate the hands. Monitor vital signs. Administer IV fluid as prescribed. Implementation. Assess saturation level. Assess capillary refill time. Administered oxygen as prescribed. Administered medication as prescribed. Elevated the hands. Monitored vital signs. Administered IV fluid as prescribed. Evaluation. Peripheral pulse palpable and strong bilaterally. Capillary refill time. Nursing assessment. Subjective data. Patient complain of severe pain like chest pain, abdominal pain, joint pain, bone pain, and pain level. Objective data. Restlessness and vital signs. Nursing diagnosis. Acute pain related to tissue ischemia. Lack of oxygen supply to tissues as evidenced by pain level. Goal. To relieve pain. Planning. Assess the pain level and location. Administer analgesics as prescribed. Increase oral intake. Keep the patient hydrated. Refer to pain management unit. Implementation. Assess the pain level and location. Administered analgesics as prescribed. Increased oral intake. Kept the patient hydrated. Referred to patient pain management unit. Evaluation. Pain level. Pain is reduced more than earlier. Our next topic is thalassemia. Thalassemia is a genetic blood disorder in which the body makes abnormal form of hemoglobin. Hemoglobin is the protein module in red blood cells that carry oxygen. There are two types of thalassemia: alpha thalassemia and beta thalassemia. The most common type of thalassemia is alpha thalassemia. Signs and symptoms: fatigue, pallor, weakness, facial bone deformities, abdominal swelling, dark urine, enlarged spleen, jaundice, and SOB. Management: regular blood transfusion, medicines to reduce extra iron from the body, daily folic acid, regular checks of heart and liver function, bone marrow transplant, 24-hour collection of gelatin therapy to estimate the amount of iron excreted. Nursing diagnosis. Nursing assessment. Objective data: pale skin and fatigue. Objective data: rapid heart rate and low hemoglobin. Nursing diagnosis: activity intolerance related to impaired oxygen transport. Goal: to improve activity tolerance. Planning. Assess the activity tolerance. Provide resting period during activities. Assess the activity of daily living. Administer blood transfusion as ordered. Provide emotional support. Administered oxygen as prescribed. Implementation. Assess the activity tolerance. Provided resting period during activities. Assess the activity of daily living. Administered blood transfusion. Provided emotional support. Administered oxygen as prescribed. Aplastic anemia. Aplastic anemia occurs when the bone marrow does not have enough red blood cells, white blood cells, and platelet. Condition result: fatigue, more prone to infection, and uncontrolled bleeding. This is a rare and serious condition. Causes: stem cells in the bone marrow produce blood cells. Example like red blood cells, white blood cells, and platelet. In this type of anemia, stem cells are damaged. As a result, bone marrow is either empty or contain few blood cells. The most causes of aplastic anemia is immune system attacking with the stem cells in the bone marrow. These factors affect chemotherapy, radiotherapy, exposure to toxic chemical, use of retained drugs, autoimmune drugs, viral infection like parvovirus, HIV virus. Signs and symptoms of aplastic anemia: fatigue, bleeding gums, SOB, pale skin, prolonged infection, skin rash, dizziness, fever and headache. Nursing assessment. Subjective data: fatigue, fever and chills. Objective data: low WBC count and pale skin. Nursing diagnosis: risk for infection related to neutropenia. Call to prevent infection. Planning: monitor vital signs, monitor WBC count daily, administer antibiotic as prescribed, maintain aseptic techniques during procedures, monitor CRP level, assess the early signs of infection, maintain skin and oral hygiene properly. Implementation: monitored WBC, monitored vital signs, monitored WBC count daily, administered antibiotic as prescribed, maintain aseptic techniques during procedures, monitored CRP level, assess the early signs of infection, maintain skin and oral hygiene. Evaluation: blood pressure, pulse rate, respiratory rate, body temperature, WBC count, CRP count. No any signs of infection. Nursing assessment. Subjective data: patient said sometime gum bleeding during brushing teeth. Nursing diagnosis: risk for bleeding related to thrombocytopenia. Call to prevent bleeding. Planning: monitor platelet count daily. Assess the skin and mucous membrane for signs of bleeding. Avoid use of aspirin and NSAIDs. Monitor urine and stool for signs of bleeding. Administer platelet if needed. Monitor platelet count daily. Assess the skin and mucous membrane for signs of bleeding. Monitor urine and stools for signs of bleeding. Administered platelet evaluation. Platelet count. Deficiency vitamin anemia. Deficiency vitamin anemia arises when the body does not have enough essential vitamins, example like B12, folate. These vitamins are essential for producing healthy red blood cells. Due to lack of enough these vitamins, bone marrow produces large and immature red blood cells, megaloblasts. These abnormal cells are less effective at getting oxygen throughout the body, resulting in a form of anemia as megaloblastic anemia. Causes: dietary deficiency, gastric surgeries, absorption problem, pregnancy and lactation, excessive cooking of foods. Signs and symptoms: dizziness, fatigue, SOP, weight loss, pale skin, muscle weakness, irregular heart rate, low hemoglobin and hemoglobin count, folic acid level, low vitamin B12 level, pale mucous membranes, numbness in the hands or feet. Nursing assessment. Subjective data: fatigue, numbness in feet and dizziness. Objective data: pale the skin, low hemoglobin level, low hematocrit level, low serum, vitamin B12 level, and folic acid. Nursing diagnosis: imbalance nutrition less than body requirements related to vitamin B12 deficiency as evidenced by low hemoglobin and hematocrit count. Nursing call to maintain normal nutrition status. Planning: assess the dietary habits and intakes of vitamin B12 and folic acid. Advised to take in vitamin B12, folic acid rich foods. Administer vitamin B12 with folic acid super supplements. Model laboratory values. Implementation: assess the dietary habits and intake of vitamin B12 and folic acid. Advised to take in vitamin B12 and folic acid rich foods. Administered vitamin B12 and folic acid supplements. Monitored laboratory values. Evaluation to be evaluated later. Hemoglobin level and hematocrit level, serum B12 level, and folic acid level. Thank you. Like, comment and subscribe our YouTube channel.